Bleeding gums are one of the most common things we hear in our practice from our patients, and surprisingly, most people think it's normal, but it's not. Healthy gums don't bleed. And bleeding is your body's way of telling you, hey, there's inflammation here. Bleeding gums are not normal. They're a sign of inflammation. When you take care of your gums, you're not just protecting your smile, you're protecting your entire body. Hi, I'm Dr. Assandas.
Hi, I'm Dr. Atwal.
And welcome back. This week, we're going to be talking about bleeding gums and what your mouth is trying to tell you. So bleeding gums are one of the most common things we hear in our practice from our patients. And surprisingly, most people think it's normal, but it's not. And they'll say things like, hey, doc, I stopped flossing because my gums were bleeding. But here's the real truth. Healthy gums don't bleed. And bleeding is your body's way of telling you, hey, there's inflammation here. So today we're going to break it down and we're going to unpack it. So why do gums bleed? Why dental probing can feel painful? And why flossing actually helps even if it bleeds at first? And how does gum disease connect to your whole body?
Bleeding gums are caused by inflammation of the gum tissue, also known as gingivitis. Here's what's happening. Bacteria build up along the gum line. Your immune system responds. Blood vessels in the gums become enlarged and fragile. So when you brush or floss, they bleed easily. Think of it like this. If your skin was inflamed and irritated, it would bleed more easily too. So bleeding isn't from flossing, being too aggressive. It's because the tissue is already inflamed.
One of the biggest misconceptions in dentistry is, like I said before, patients say, every time I floss, my gums bleed, so I stopped. But here's what's actually happening. Stopping flossing makes the problem worse. So flossing regularly actually stops the bleeding over time. Why? Because flossing removes the bacteria that causes the inflammation. At first, you may see bleeding, you may feel tenderness. Within about 7 to 14 days of consistent flossing, most patients see a difference. They see less bleeding, less swelling, and healthier gums. And bleeding is not a reason to stop flossing. It's a reason to consistently floss more.
At your dental visit, we measure gums using a small instrument called periodontal probe. Patients often ask, why does this hurt sometimes? Here's why. When gums are healthy, the tissue is firm, there's minimal inflammation. Probing feels like pressure, not pain. But when gums are inflamed, tissues become swollen and sensitive. That's why it can feel tender or even painful. And if it bleeds during probing, that's actually a clinical sign of active inflammation. It's one of the most important indicators we use to assess gum health.
So let's talk about gum disease and inflammation. Gum disease is not just a mouth problem, it's an inflammatory disease. And inflammation doesn't stay isolated. When your gums are inflamed, bacteria enters your bloodstream. Inflammatory signals circulate throughout your body, and this can contribute to a lot of chronic health issues like heart disease, diabetes, pregnancy complications, cognitive decline, and many more. Your mouth is not separate from your body. It's the gateway to your overall health.
Let's make this simple. Healthy gums should be pink, not red or purple, firm, not puffy, do not bleed when brushing or flossing, and do not hurt when probed. If you're seeing bleeding, swelling, or tenderness, that's your early warning sign. And the good news, gingivitis is reversible when caught early.
So if there's one takeaway from today, it's this. Bleeding gums are not normal. They're a sign of inflammation. And instead of avoiding flossing, that's actually what you need to do the most. Because when you take care of your gums, you're not just protecting your smile, you're protecting your entire body. Because we all know that a healthy life starts with a healthy mouth. Thank you.